It's a point of contention for many in Penticton.
That is a disease, they need treatment, they need help, but with a dry facility model.
That comment made at an information session on a proposed tiny homes project by BC Housing. It's part of the province's Heart and Hearth program that provides both outreach services and housing. Residents told from the very beginning that this site would have to have an overdose prevention service.
It's important to also note that the province will not fund Heart and Hearth programs that are considered a higher barrier or dry.
But BC Housing recently approved a new 20-unit housing facility in Victoria with no on-site substance use. Amelia Boutlbee is the MLA for Penticton Summerland.
And the understanding of the residents was that only a wet facility would be funded here in Penticton, and I believe there's some confusion among the public as to why that is.
But Housing Minister Christine Boyle says Victoria is a much different situation than Penticton.
Victoria and elsewhere where there is already a fair amount of low and medium barrier housing that supports people coming off the street, dry housing is or could be an important part of that continuum.
Boyle adds the site in Penticton would house the maximum amount of people.
This is what we know is needed in Penticton to address the concerns that have been raised there and to help bring people inside.
Penticton City Council heard that if a dry facility was put in, it would only help around 10 people versus the 50 in the current proposal. The city's last point-in-time count found 194 people considered homeless, 81% of which struggle with some kind of substance addiction. The need is why some Penticton residents are in support.
I think that we need to do whatever we can to help out those who are most disenfranchised, those who are at their most disadvantaged.
However, Boutlbee wants the province to do more to address the root issues around mental health and addictions.
We currently have 0 detox beds and very limited treatment beds. And to the extent that there are treatment beds or even detox in other communities, the wait list is up to 1 year.
City Council is expected to make a decision on the tiny homes on December 2nd. Tiffany Goodwein, CBC News, Penticton.